So I think we have everyone in the meeting. Thank you so much for being here. My name is Heidi Finnis, and I am the current president of HOPA, and it's my pleasure to welcome you here to our second town hall meeting. On behalf of the HOPA Board of Directors and our extraordinary HOPA staff, I want to wish everyone a very happy Pharmacy Week and extend a sincere thank you for all that you do daily to care for patients with cancer. It is because of you that many patients have been able to continue treatment during the COVID-19 pandemic, and your extra hours of hard work and dedication have not gone unnoticed. While this is a special week to celebrate our careers in pharmacy, I want you to know that every day, HOPA celebrates you, our pharmacy heroes. It is now my pleasure to introduce our moderators for today's HOPA Town Hall on the topic of advocacy, Jeffrey Pills and Taylor Monson. Jeffrey is currently serves as an assistant director of pharmacy for medication safety and drug policy at the Ohio State University Wexner Medical Center in Columbus, Ohio. In this role, he serves as a facilitator for several pharmacy and therapeutics committee stakeholder groups and a co-chair for the Drug Shortages Committee, with responsibility of coordinating Department of Pharmacy initiatives related to formulary management, mitigation of drug shortages, and policy oversight. Jeff is the current chair of our Public Policy Committee. Taylor Monson is a clinical oncology pharmacist at the University of Kansas Health System, where she specializes in melanoma and breast solid tumors. She also works on the clinical oncology reimbursement pharmacy team. Taylor is our current vice chair of the Public Policy Committee. Jeff and Taylor, please take it away.
Thank you for the kind introduction, Heidi. Next slide, please. So I appreciate everyone joining for the Advocacy Town Hall today. And just broadly, HOPA's advocacy goals are really focused on a lot of different areas and involve a lot of different volunteer committees within the organization. But the ultimate aim is to advocate for both the promotion of the hematology oncology pharmacy specialty, but then also serve as that platform for patient care issues. The four main goals are to increase awareness of what a hematology oncology pharmacist brings as a trusted and resource to the patients and other healthcare professionals as part of the care team, to also increase those patient experiences and opportunities to participate in advocacy initiatives and share their personal stories, to expand HOPA's footprint in the areas of safety, quality, and access to care, and to also build on HOPA's collaborations with our peer organizations and other advocacy groups in the cancer care space. The main volunteer group that performs these actions is the Public Policy Committee, so certainly advancing the public policy agenda, and then also serving as a resource as subject matter experts to inform on different policy needs, but then also identify new challenges and new opportunities for policy opportunities in the future. This group also identifies and promotes opportunities to engage with our state and federal government leaders and works very closely with our HOPA government relations consultant. And for purposes of today's discussion, we'll focus mainly on the efforts in the public policy space.
One of the ways HOPA supports advocacy is through our public policy initiatives and priorities. This year, we have three primary focuses to advocate for both our profession and our patients. The first of these is pharmacist provider status. HOPA continues to support and advocate for this legislation, really in hopes to increase patient access to pharmacist services and also achieve eligible provider status for providing care to those patients. That would give us reimbursement for those services in underserved communities. Additionally, HOPA also supports the current legislation surrounding oral chemotherapy parity, which, if passed, would require insurance companies to cover oral anti-cancer agents under no less favorable terms than intravenous cancer treatment. This would ensure that all treatments are covered at the same cost sharing for patients. So regardless of administration route, this would allow for all of these to be covered on an equal playing field and would ultimately improve access to care for cancer patients. Finally, for the first time ever, HOPA is looking to make our own piece of legislation with collaboration from other oncology and pharmacy organizations. And you'll be hearing a lot more about this in the coming months as the Public Policy Committee continues to share more about this exciting new project. HOPA members met with legislators at our recent HOPA Hill Day to discuss all of these policies and pieces of legislation in hopes that we can pass them, and will continue to support future legislation related to these issues. Additionally, our Public Policy Committee also meets to discuss other common issues related to HEMONC pharmacy practice. In the past, we've discussed and drafted issue briefs on topics such as biosimilars, drug shortages, and drug waste. And the committee is currently working on briefs related to site of care and white bagging. These briefs are short statements with supporting information related to these issues, as well as a stance from HOPA regarding the issue. We're always open to hearing more from our members about the issues that you're all facing in clinical practice for future briefs as well. Next, I'll turn things over to our HOPA staff. We have Brooke Boring and Jeremy Scott. Brooke is HOPA's Senior Manager of Health Policy and Advocacy. In her current role, Brooke serves as the staff lead for the Policy and Advocacy Department and is staff liaison for a number of HOPA committees, including the Public Policy, Patient Outreach, Quality Oversight, and Patient Education committees, as well as the HOPA Ambassadors Task Force and Oral Chemotherapy Collaborative. Jeremy Scott is a Senior Vice President in the CRD Associates Legislative Practice in Washington, D.C., where he focuses on healthcare policy and representing the issues of nonprofit, advocacy, and health organizations. In his current role, Jeremy serves as the HOPA's government relations consultant and has represented HOPA in Washington, D.C. for over a decade.
Thank you, Taylor. So today, Jeremy and I will be talking about how to get involved in HOPA advocacy. We just wanted to start today by answering some frequently asked questions. So the first question that we have is, what actually is advocacy at HOPA? So typically when people hear the word advocacy, I think they typically think about the policy aspect. So having a Hill Day, working on pieces of legislation, things like that. And that's what we'll be discussing today in more detail. But HOPA advocacy actually encompasses more than what we just do in the policy space. So we also work with patient advocacy as an organization. So the Patient Outreach Committee and the Patient Advisory Panel do a lot of work building relationships with patient advocacy organizations in the cancer space. HOPA advocacy is also about raising awareness about HEMONC pharmacists, letting people know that HEMONC pharmacists exist and they're not the same type of pharmacist that you see at your local Walgreens, but also spreading the word to the public, to people on the Hill, and to different healthcare professionals about what HEMONC pharmacists can offer and what value they bring to the cancer care space. So who can really get involved in HOPA advocacy? And the answer is all HOPA members can get involved in advocacy in some way. So that's going from pharmacy students who are still in pharmacy school and haven't chosen their specialty yet, all the way up to our current and past board members. I also wanted to note that no matter what your practice setting is, there's a place for you in HOPA advocacy. So if you're inpatient, outpatient, infusion, specialty, if you work in the industry space, any and all of those pharmacists are welcome to get involved. And then we also have on here committee members. And so if you are currently on another HOPA committee, whether it's within the advocacy council or another council, you are welcome to get involved in HOPA advocacy, and we'll share the ways you can get involved here in a second. The only way that you wouldn't be able to get involved is to also join another committee, but all of the other ways are open to you as current committee members. So what kind of expertise and background do you need in order to get involved? Do you need an extensive background in health policy and the legislative process? And the answer is no, you do not. We would like for you to have some interest in this process and what's going on in the Hill, but if the extent of your knowledge is the I'm just a Bill song from Schoolhouse Rock, that is totally fine. Jeremy and I and our team are here to help you and teach you about the legislative process and all of the things that you need to know in order to be prepared. But you do not have to have a health policy background in order to get involved. Do you need to have experience advocating on Capitol Hill? No, you do not. So as Taylor mentioned, we had our Hill Day a few weeks ago, and about half of the people who came with us for that Hill Day actually had no experience advocating on Capitol Hill, and it was their first time. Again, that's something that we help prepare you for, and I'll talk more about Hill Day in a second here. But if you have no experience on the Hill, you can still get involved. So really it comes down to the ability to speak about HOPA and your profession knowledgeably. I tell the committees that as long as you can speak about what your role is as a hem-onc pharmacist and why it's important to patients, that's all you need to be able to do to start getting involved. And the P&A team can help you and teach you more about the specific bills that we're talking about and all of the technicalities of that. But just all you really need is to come in with an open mind and be able to concisely speak about what you do in your daily role. So what are examples of ways to get involved in HOPA advocacy? And I think this is the one that we probably get the most questions about is Hill Day. And so every year HOPA hosts an annual Hill Day. And if you're not familiar with Hill Day, if you're a member of other organizations, you'll hear them called fly-in days, you'll hear them called advocacy days. But really what we do is we take our members to Capitol Hill in Washington, D.C., and we schedule meetings with the offices of our members' elected officials. And you have time with all of those offices to teach them about hem-onc pharmacy, what you do and why it's important to cancer patients. And so we had our Hill Day a few weeks ago in 2022. And so we're looking forward to our Hill Day in 2023. And for the first time ever, HOPA will be offering 2 Hill Days in 2023. So last year in 2021, due to COVID, we actually had to host Hill Day completely virtually. And we did that by scheduling over 40 Zoom meetings with different offices. And our members were able to take those meetings from their actual houses or where they work. And we learned a lot about those virtual events. And one of the benefits of them is because we don't need to travel to Washington, D.C., we can actually open those events up to more of our membership. So during the last year's virtual event, just to try it out, we opened it up to the Advocacy Council committees. And we had around 26 participants. And so next year in the late spring, early summer, no date is set yet, we will be doing a virtual event. And we'll put out some communications and your member updates if you would like to apply to get involved in that Hill Day. I think a virtual event is also beneficial because as a member, if you have no experience going to Capitol Hill, not only if you attend in person, do you have to kind of understand the talking points and things like that, but you also have the added pressure of needing to navigate the Hill and try to find all of your meeting locations. So one of the benefits of a virtual event, especially if you've never done this before, is that you don't have to worry about all that. All you have to worry about is kind of what to talk about in your meetings. And then we'll also go back to DC next fall in person and have our in-person Hill Day. And we also offer scholarships for members who are not involved in the Public Policy Committee or on the Board of Directors to apply to go to DC with us in the fall. So what are some of the benefits of participating in a Hill Day? So the first benefit is this is an opportunity for you to have face time with the individuals involved in making decisions that affect your daily practice. So these are the people who help educate your elected officials about health issues. And this is really your opportunity to share your story and your experience with those individuals. This is also an opportunity to raise awareness about hematology oncology pharmacists and their role in cancer care. And it's also really intended to help build ongoing relationships with elected officials in your state. And so while Hill Day may be the first time you communicate with the offices of your elected officials, it should not be your last. You should maintain communication with those offices, and every few months or so, reach out and say, hi, we spoke at HOPA's Hill Day, and this issue is coming up in our practice that I'd like you to maybe consider as an issue that you get involved in on the legislative side of things. So here are a few pictures from our Hill Day this year. And we completely understand that Hill Day can be very intimidating. What we want to assure you that we're here for you, and we teach you everything that you need to know to prepare you before going into these meetings. So you'll receive a training before the Hill Day. You're going to get information packets with talking points in them. If you're going to the in-person Hill Day, we'll have a dinner and a strategy session the night before, so you can meet with your teammates and talk about who's going to say what during your meetings. And then we'll also, our intent is to pair you, if this is your first time going to the Hill, pair you with another member who has more experience in this area, who can help you navigate and show you what these meetings are all about. So as I said before, this is really an opportunity to start a conversation with the offices of your elected officials. And next, Jeremy will go into really what that can look like.
Thanks, Brooke. So as Brooke alluded to, and as Taylor said, it's important that your elected officials, both at the state and federal, but again, focusing on federal, here in DC, hear from you, both as a provider and also regarding your patients. But the one misconception is that you need to travel to DC to be able to do that, to be able to meet with your elected officials. And that's not exactly true. You actually can meet with your elected officials back home in the state or district where you reside. Actually, members of Congress spend a significant amount of time back home. They're usually back home on a Friday through the weekend, and they leave late Monday afternoon to fly back to DC. So they usually take meetings on Mondays as well. And there's also a lot of quote unquote recess time where members go back home to do district work. And right now they're actually back home. They've been back home almost the whole entire month of October. Given that we're leading up to an election. So there's ample time for you to meet with your elected officials back home. And again, as Taylor and Brooke have both alluded to, you tell them your personal stories. Talk about what's going on in your practice, the things that are working, the things that aren't working. Talk to them about what are the patient needs. How do your patients need to be able to access the drugs, things of that nature. So that they better understand. You have to remember that these elected officials cover every issue: transportation, defense, environment, and healthcare. And so they really do rely on your expertise as HEMONC pharmacists to better understand the issues that impact their constituents. Another good way that we're always trying to talk about is to participate through our action alerts. If you go to HOPA's Legislative Action Center, there's a lot of resources there, but the action alerts that we have posted for our issues that HOPA is trying to engage on the Hill are there. So if it's an appropriations related request, there's an action alert there. There's an action alert for the Cancer Drug Parity Act, which is the oral parity bill. And there's a template letter there. We highly encourage you to personalize that template letter. But really, essentially, all you need to know is your zip code. You don't even need to know who your elected officials are. It'll automatically populate who your elected officials are, populate that template, but please do personalize it.
So you may be thinking, okay, great, I'd love to reach out to my elected officials, but how do I actually do that? I don't even know where to begin. And so HOPA actually offers some resources and tools to help you with that process. So we have an advocacy toolkit, and we are working on revamping it at the moment. So we'll have an updated one coming in 2023. But what this toolkit contains, it contains a lot of different information, but it gives you information about basics on the legislative process and how a bill gets passed. It tells you information on how to communicate with your policymakers, how to best share your stories, what you should talk about in your meetings. It also gives you information on how to set up a meeting, where to go to even schedule one of these meetings in the first place. And then something that we are not going to cover in detail today, but is using social media for advocacy. Social media is extremely powerful. And so if you have a Twitter and you can reach out to and you can tweet your elected officials. And if something is coming up, you can just say, hey, we'd love you to support this bill, and tag them all in your tweets. They have staff who actually do monitor their social media page very closely. And so that's another just kind of quick way to reach out to people. If you don't have time to schedule a full meeting, you can just tweet at them. And tweeting is also a great way, or posting on any of your social media is a great way to raise awareness in general. So of anything that you do as a hem-onc pharmacist. So as I said, if you go on our website and you find the current toolkit, you'll notice that there's information on there from a few Congresses ago. So we're working on revamping this toolkit, and you'll get an announcement in 2023 and likely your membership emails letting you know that that new toolkit is ready. But all the other information in that toolkit stays accurate throughout the years.
Yeah, I would echo what Brooke said. The nuts and bolts of what's in the toolkit is good no matter what Congress you're in, no matter who's in power. So again, disregard some of the outdated stuff if you need to use it in the next couple of months. But again, we will be updating that. So state engagement, we get asked this quite a bit. Like, does HOPA engage in at state level activities? And the answer to that is traditionally no. HOPA doesn't necessarily engage in state issues. We traditionally stay sort of in our lane, which is the federal issues. And there's a couple of reasons for that. It's not that we don't want to engage in a state. It's very taxing to engage in states. There are 50 different states. Each of those state legislatures meet at different times. Some are 2 years, some are 3 months, some are 6 months. So you really need a team of not just advocates, but a team of folks to sort of monitor and manage different regions within the country to be able to really successfully engage in state advocacy. If you're a very large organization, you may have the bandwidth to do that. But we do rely on you as advocates and as people back in your states to notify us or to communicate with us on issues that you see happening at the state capitals in your states. Again, as we often say, if you've seen one state, you've seen one state. They just really are really different. However, the caveat is that there's a lot of times that there tends to be a lot of activity in the states and not a lot of activity going on at the federal level. Well, all of those activities within the states sometimes propel the federal government to wake up and take notice, primarily because they don't want 50 different state laws. So if there's an issue that the federal government can engage on that would prevent 50 different state laws and have one that's sort of overarching, they tend to do that. And so again, we rely on you as HOPA members to let us know what's going on in your states. Again, we keep tabs for trends. We also keep tabs because there are a lot of our stakeholder partners that engage at state levels, and we can help facilitate that. And a couple of examples of some of our engagement, white bagging. I know that's a big hot issue in a lot of states, and we've been monitoring that over the course of the last couple of years. Wisconsin's been very engaged in that. And then over the years, we've also engaged on the oral parity at the state level. Primarily, one that comes to mind is North Carolina. It's one of the states that does not have a state parity law, and HOPA member Justin Arnell was sort of our boots on the ground when that bill was before the North Carolina State House. So again, please do let us know what's going on at the state level. But again, we tend to keep our lanes focused at HOPA at the federal level.
Yeah, so that leads right into our next point is bring us ideas. Don't only just keep us kind of knowledgeable about what's going on in your state and the issues that you're facing, but if you have specific ideas on things that our team can engage on, if something specific is impacting your practice or your patients, we want to know about that. And so you can email our general advocacy inbox. You can also email me directly. And these are actually things that we have actionable items on these. So a few member ideas that turned into projects. We've had issues with the drug shortage survey. And so we all know drug shortages are happening everywhere. And so about 10 years ago, a HOPA member brought that to our attention, and we created the first version of the drug shortage survey. And then we copied that a few years ago to create the second version, which was just recently published in the Journal of Oncology Practice at ASCO. And so that's something that was brought to us by a member that we then took action on. Other projects, so we had some conversations and some members reached out to me asking about white bagging and site of care. And so the Public Policy Committee took those under considerations. We had discussions about those issues. And what came out of that is these new issue briefs that will be published in the coming months here with our stance on white bagging and site of care. So any things like that that are coming up that you're hearing about a lot, please let us know what those things are, and we are happy to engage you on those and explore further what those issues are.
So this is the opportunity for Brooke and I to sort of plug attending the annual meeting and then also attending our annual advocacy update. Brooke and I, as well as the health policy chair. So this coming conference, it will be Jeff Pills. We presented at the annual conference, a session. We pretty much provide you all with sort of a legislative update. We kind of review, again, the health policy agenda, the issues that we're working on, the issues that Congress is working on, which sometimes may vary from the issues that we're working on, a landscape of sort of the political environment. And again, we also try to put a plug for engagement. So a lot of some of the stuff that you've heard today, we sort of reiterate. Repetition is good, I was told when I was young. So we like to repeat a lot. And so again, your engagement and how you engage is critical to our collective successes. Again, it's also an opportunity for you to ask us questions directly, either live or afterwards. We tend to hang out. We're usually at conference the whole week, and so you can pull us aside, but it's a great opportunity for you to have a little one-on-one time with the P&A team and sort of help you if you have issues, questions, or if you need further assistance.
And our final example of ways to get involved here is join a HOPA committee. And so I know we focused a lot on what the Public Policy Committee does today, but when it comes down to it, advocacy is really a numbers game. It's about a lot of people speaking about the same thing over and over again. And really our goal within HOPA advocacy is to build a community. We need to use a lot of different strategies in order to make a difference and really put on a unified front and spread the word about Hem/Onc pharmacists. So the Public Policy Committee does that on Capitol Hill, but the Patient Outreach Committee is involved with our patient advocacy partners in spreading awareness about Hem/Onc pharmacists in that space. The Quality Oversight Committee is heavily involved in really getting us data and proof about the value of Hem/Onc pharmacists and what they bring to the healthcare team. And then this year, we also have a new task force, the HOPA Ambassadors Task Force. And so the HOPA Ambassadors Program is a new program that's going to be launched sometime next year. And really what HOPA Ambassadors are members of HOPA who are willing to go out to their communities and speak about HOPA. So these people may attend different conferences, may go speak with different patient advocacy organizations. They can go speak to colleges of pharmacy or industry partners, a lot of different opportunities there, but to really go educate people in the community about Hem/Onc pharmacists and why they're important. So our HOPA Ambassadors Task Force is really working hard right now to lay out the infrastructure for the Ambassadors program. But sometime in 2023, you'll get an announcement from HOPA about applying for the inaugural class of HOPA Ambassadors. So if that's something that sounds interesting to you, we encourage you to apply once that program launches. So if you have any questions for Jeremy and I, feel free to leave them in the Q&A, and we will get to those at the end of this presentation. But now I'd like to turn it back over to Jeff to introduce our first testimonial speaker.
So hopefully after hearing some of those tools and all the opportunities and assistance that we provide through HOPA, most of you are excited about the ability to advocate. It's certainly a huge lift that Brooke and Jeremy do to make it easy for all of us as members to jump right into this, even with no past experience. But to share some of the rewards and kind of the way that you can exemplify this advocacy, we have testimonials from two of our past leaders of the Public Policy Committee. First up is Mark Ham. Mark is currently Director of Oncology Pharmacy Practice at Wisconsin at Advocate Aurora Health. He's directly responsible for operations and clinical activities at 11 cancer care locations in the Milwaukee, Wisconsin area, as well as the inpatient oncology services at Aurora St. Luke's Medical Center. Mark is the immediate past chair of the Public Policy Committee.
Well, thank you, Jeff. I'm really glad to be able to share some of the experiences from the past couple of years, because it's really reshaped my view and how I see advocacy work and how each of us can get involved. So my journey with advocacy work actually began with ASHP in 2016. And at that point, I applied for ASHP Council, and that happened, public policy happened to be the one that I was appointed to. So that was really my first exposure to this work and my first Hill Day with them. And then in 2018, I applied for the Public Policy Committee with HOPA, and I have been a committee member, vice chair, chair, and now immediate past chair in that group. And I think there's really two different ways that I saw the work that HOPA is doing in this space. As a committee member first, it really exposed me to some topics that I may not see in my day-to-day. So just from an understanding perspective and knowing what's going on out there, being part of this group really helped expand my view. Actually being in the chair role and getting to work more directly with Brooke and Jeremy, my gosh, you learn so fast what goes into making one of these efforts successful, and just how iterative this advocacy and legislative process can be. And I'm not saying this just because the two of them are on the call right now, but they are truly excellent at what they do. And the way that they are able to simplify and break things down for those of us that don't do this every day really makes a huge difference in feeling comfortable going into this space and going to Hill Days or speaking with others on some of these topics. So as far as other experiences that I've taken away from this, by, like I said, listening to the two of them talk, it's also allowed me to expand into issues within our own state. So Jeremy referenced earlier white bagging in the state of Wisconsin and a lot of the efforts that have been taking place there. I won't kid you and say I know the ins and outs of everything that needs to happen, but I felt very comfortable working with some of our state advocacy folks within our health system to help raise this issue to them, why we think it's a big deal and what we could do about it. And in working with the Wisconsin Hospital Association, they pulled many of us together across the state and had the opportunity to testify before both the Assembly and the Senate within the state, which is another pretty cool experience to do just what Brooke said, is share what you know and what you're seeing on a day-to-day basis, because you know more about what's going on than they do. And even if you don't feel like it, just telling your story and what you see on a day-to-day basis leaves them knowing more than they did before you went in and spoke with them. As far as number of Hill Days, I believe I've done 3 now with HOPA, so 2 in person and 1 virtual. And agree with what Brooke said there too with the virtual aspect of it, is that it just lets so many more people get involved in a non-threatening way, that if this is entirely new to you, most of us are very familiar with Zoom or Teams or whatever you use at this point. So it's, again, just talking to someone on screen and telling them what you know. The reason that this has become so important to me to share this efforts is just listening to Jeremy and Brooke talk about how these initiatives pass, the number of people that need to be involved, supportive, and getting the message out to everyone has really resonated with me. And it's also become clear that if we want to advance our practice and how we're able to care for patients, a lot of that is going to be through different legislative initiatives, whether it's at the state level or at the federal level. And the more of us that we can get talking about this to educate ourselves, and also to educate patients. That's an aspect I hadn't thought of so much before this year when we brought patients to Capitol Hill with us to help share their story. But the more we share what we know with them, well, now that's another extension of our voice to make sure that more people are hearing the issues that we find so important.
Thank you for that, Mark. We'll now turn things over to Sarah Hudson DeSalle, another one of our pharmacists here as a panelist. She is the manager of reimbursement services and the medication assistance program for infusion services at the James Cancer Hospital and Wexner Medical Center at the Ohio State University. She oversees the reimbursement staff who obtain authorizations of infused medication and files medication denials at the James and Wexner Medical Center. She also oversees, coordinates, and advocates for the award-winning medication assistance program for patients who cannot afford their infusion medications. Sarah is active in pharmacy organizations at a local, state, and national level. She serves on the board of Charitable Pharmacy of Central Ohio and the Financial Advocacy Network Committee at Association of Community Cancer Centers. She also serves on the Public Policy Committee of the Hematology Oncology Pharmacy Association and is a past chair of the Public Policy Committee.
Thank you for that kind introduction, Brooke. I really appreciate it. I was just going to say thanks for having me today. I have been involved with the HOPA Advocacy and Public Policy Group since about 2008. And initially tried out a couple different committee groups when I first joined HOPA, and really gravitated back to the Public Policy Committee, and have since served as a member, a vice chair for a year and a half, and then as a chairperson, then an immediate past chair, and really have found, you know, the work that the Public Policy Committee does is very meaningful. And I think that it is one of the things I've organically gravitated towards that, because the work that was being completed really helped to elevate like the role of the hematology oncology pharmacist, be able to be a voice for those patients and our practices that needed that focus, whether it was about around drug shortage information, whether it was as far as we've touched on GDUFA information of being sending members to be expert testimonials in a federal level at HHS. HOPA has been trying to really represents themselves as the pharmacy experts, and I think that is one of the things that when we go in and talk to folks, we really want to personify that's who we are and what we do. We are the experts in that field, and I've participated in 5 in-person Hill days in DC, but like honestly, my first experience with legislation was on a state level with brown bagging and chemotherapy parity in the state of Ohio. And so I got a little bit of a crash course in interested party meetings, a collaboration with elected officials, and understanding that they just want to understand how we do our job and how things that if there's certain legislation that's there, how that impacts us. And I think that it is a bit, when you go on Hill Day, it's a bit like speed dating. You have to tell as much as you can in a very focused fashion on with a very specific ask or request to those folks. And really, if you're engaged and passionate about that, it comes across and folks will be interested. And sometimes they're not, but the majority of the time they're interested in what you have to say. I have learned that I'm horrible at Twitter. So I do many times will just retweet things that folks do when we are on Hill Day. So maybe there needs to be a little bit of a social media workshop for folks like me. But really, I keep coming back to this. It's kind of that JFK, quote: "The one person can make a difference, and everyone should try." I actually have that magnet on my refrigerator that I see that every morning, and going in, and that's how I approach my work. And I think that this is how HOPA, what Brooke and Jeremy have helped to teach me, year after year, is there are various issues that come up. How do we position ourselves to be a good voice for our patients, our practice, and in the institutions where we work? So I really appreciate the opportunity of being able to serve on the committee and be able to participate with the Hill Days.
Okay, it is time for our question and answer session. So once again, if you have a question that you would like to ask one of our panelists, go ahead and pop that into the Q&A chat. And then to start off, it looks like our first question, a number of our pharmacists are maybe in non-traditional roles or diverse roles that don't necessarily align or have direct involvement with some of the current initiatives that we're focused on for this year. Are there ways that those pharmacists and members can still get involved in advocacy?
I can start with that. So absolutely there are is my quick answer. So I think this person said that they're a research oncology pharmacist. And so when we spoke about Capitol Hill, but when it comes to HOPA advocacy, we work with different entities on the Hill, including different agencies. So Health and Human Services, Centers for Medicaid and Medicare, and I think kind of applicable to this individual, the FDA. And so there are so many different topics that come up every year, and it changes with each new Congress and each new president, what their focuses are. And that's kind of how we tailor our topics. But if there is something that's coming up that's pertinent to you and your role, please just let us know about that. I think just because we don't have it on the list starting out the year does not mean that we will not engage on it during the year. So things like clinical trials is always a big one, and access to clinical trials, diversity in clinical trials. The FDA will have specific questions about how clinical trials work and what processes are happening and how we can improve processes, things like that. So if you're not in a traditional role, we still want to hear from you, and we still want to know what's going on in your practice, because we don't just want to represent the traditional roles at HOPA Advocacy. We really want to make sure we represent all of our membership with our work. So Jeremy, I'll let you add to that.
Yeah, the one thing I would add is Brooke and I did not discuss today all of the activities that she and I and HOPA are engaged in outside of HOPA, so coalitions that we participate in. We sort of laid out sort of and tailored at the beginning sort of the issues that we're tracking, and then some of the ancillary sort of others like biosimilars that we sort of engage on. But there are a lot of issues that we work on through coalitions that we just don't have the bandwidth to work on. But HOPA does lend their name, expertise, and input on many of those issues. A lot of the agencies that Brooke mentioned are agencies that a lot of our coalitions sort of work in. And when I mean coalitions, I mean other external partners, whether it's other provider groups, patient groups, hospital systems. So we do more extensive sort of issues tangentially through these coalitions than we may present to you today or may have presented to you today.
And just a quick note on kind of HOPA policy, we recognize that our pharmacists likely have conflicts in some areas. So when you're engaging on this, we would ask you to just make your conflict known if there is one. So for example, we have some members of the committee who are involved on the industry side of things. And when we talk about things revolving around industry, drug pricing, anything like that, they just recuse themselves. So that's as simple as we get on your level of involvement. Just make sure your conflicts are known, and we can still very much help you and would like to engage you on those issues.
Thanks, Brooke and Jeremy. Our next question is about the HOPA Advocacy Toolkit, and if that is available to HOPA members, if that's something that is free or something that would be an additional fee for members.
Yeah, so the HOPA Advocacy Toolkit is completely free. It's on our website right now. I know we're in the middle of a website redesign, so it might not be the easiest to find, but the full toolkit is on our website. We also have a little video showing you just kind of a video version of the toolkit, if you will, on our website, as well as other tools and resources with advocacy. So all of those things you can find on our current website, and then they'll also have a place on our new website as well. And then we will work with our marketing team to communicate when that toolkit is revamped and updated. We will make sure our members are aware of that.
Thanks, Brooke. And our third question, this is a little bit specific, but California now has SB 1191, which is proposed to allow pharmacists to order pharmacogenomic tests. Has this been any connection to HOPA legislative involvement? And more broadly, what is HOPA's involvement at the state level?
Jeremy, do you want to start on that one?
Yeah. The quick answer is we haven't engaged on that particular issue in California. Again, it's good to be on our radar. I really hadn't been focused on what's the bill in California. So I saw the question in advance, so I quickly pulled it up to see what's happening at the federal level. And there's not a whole lot at the federal level that would sort of be related to what they're doing in California. Again, just to reiterate, we meaning Brooke, myself, and the team here typically would not necessarily engage in any sort of specific piece of legislation in any state. Again, we would like to know, so thank you for flagging it for us, because we'd like to know, because we want to keep tabs on it in case there is something that pops up at the federal level related to what they're doing in California. It's also good to know if this particular issue starts cropping up in other states. So those of you who are not in California and other states also sort of hear about the pharmacogenetics testing, please let us know. But we're happy to, help you along the way. Again, a lot of the tools that we sort of went over quickly today, the tools that are on HOPA's website can be used both from the federal level, the state level, and your local level. It's all the same thing. You just talk a different way and you're addressing a different issue. But generally speaking, everything is sort of done the same way. But happy to talk offline. Brooke, I don't know if you have anything to add.
Yeah, I'll just add, I think this is a perfect example of a way that you can get involved at your state issue. So number one, letting us know. So this was perfect, letting us know about this issue. But also, I don't know if you guys have this experience, but I know I do when I have the local news on or the national news on and I hear about a piece of legislation that's in front of Congress or the state legislature. And I think to myself, well, that won't work because of da-da-da-da-da. And part of advocacy is, well, I don't just whisper that to myself. You go tell somebody about that. Go tell somebody in your state legislature. Go talk to your member of Congress. Send them an email. Say, hey, I heard about this bill or this piece of legislation, and I am a hematology oncology pharmacist, and these are kind of the barriers that we would have, or this is why I would be supportive of the bill, things like that. So that keeps that dialogue open and keeps hematology oncology pharmacists kind of in people's minds as stakeholders in the cancer care space. So those are just opportunities. If you see anything coming across at your state level and you look into it or read an article about it or something, and you notice some red flags or some opportunities, like I know a lot of the details of things, they're written by people who are not sitting in your seats, who are not cancer care providers. They're written by people in Washington, D.C. And so when it comes down to those details, you are the people that they need to hear from to tell them, well, if something would work or not. So that's kind of another opportunity for you as members to get involved in that space. And thank you, Joan, for putting the toolkit in the Q&A there.
So I had a question potentially for Mark or Sarah. Is there a good place that you keep up on what's going on in your individual states, or for members of our organization who would like to get involved with some of their own state initiatives, that they know, when there would be open comment or when their representatives might be voting on something to keep better aligned with what's going on?
I can take a quick crack at that. Probably the first step that I would suggest to folks is to reach out to your governmental affairs group within your facility. Lots of times there are local or statewide initiatives that they already may be engaged in, and they could use your voice to be collaborative with those initiatives. Also, I mean, honestly, of like local papers, I prescribe to a couple different listservs, and reading those headlines of things that are being introduced, and really just being kind of interested and curious around what's happening in that, and so being still engaged, and that's the other thing too. So some of the pharma groups have advocacy divisions. I touch base with them periodically to see is there anything that's being introduced that I would be interested in, or is there and sometimes they'll come and ask us for patient stories too. So just a couple things.
Yeah, I agree with those. The government affairs, I think, is a great call, Sarah, because we have a regular blast that goes out through email that I didn't know exists. My name just wasn't on the list, and it was very easy to get added. So not only is it learning about pharmacy initiatives, but you're learning about everything the organization cares about and what they're doing, both state and federal. And they love pictures. So if you're doing anything, they will gladly snap your picture and add you in there to support the work that you're doing. The other two I might add are just your local pharmacy or state pharmacy organization. So for us, that's Pharmacy Society of Wisconsin. They have a blast that comes out, and usually there's an advocacy section of it there of key initiatives going on. And then I mentioned the State Hospital Association before too. And for both of those, that can be just signing up for blasts. You don't necessarily even have to sign up to be a member, but you can get the email information that they put out on these topics, just raising awareness, and then it comes to you, so you don't even have to go searching for it. And it's just an easy way for you to stay informed of what's going on.
And then I think we have another question. Can you describe what is in the toolkit and how this will help members get started in their advocacy journey? So that toolkit, and the link is in the chat or the Q&A there. That toolkit is really kind of a starter pack for how to do advocacy. So it talks about Congress, and it talks about how kind of the legislative process, how Congress passes a bill. It talks about information about, okay, I want to reach out to my congressman or woman. How do I even do that? So it gives instructions on how you can contact their offices, how you can go about setting up a meeting. Something else that's also included is I know I'm still in this position where I'm listening to a podcast or I'm watching the news and they're using terminology that I'm not necessarily familiar with. So that that toolkit also offers a glossary of terms that have to do with the legislative landscape and keeping you more informed about, okay, what does appropriations, what's an appropriations bill? What actually is that? I've heard the word, but I don't know what it is. So terms like that are in that toolkit as well. And then, like I mentioned earlier, the social media aspect. I mean, it's a pretty comprehensive packet. And then we'll be adding some more information as we do our revamp. But that's just kind of a good place to start if you have those basic questions of how do I actually do this logistically. And then, of course, Jeremy and I are always here for you at any time. If you want to send us an email or set up a quick call for us to chat, and you need help on a specific issue or how to even what to talk about in a Hill meeting or something like that, we're also a resource that you can reach out to at any time. Jeremy, anything to add on that?
No, it's like you said, it's pretty comprehensive, but I think it's pretty easy to digest. For as Mark said, for those, this isn't your day job, we tried to synthesize it in a way that that it would be easy to digest for you all. And then lastly, it just gives you sort of specifically like the switchboard call if you wanted to make a phone call, like it gives you those sorts of things that easy at your fingertips, so you don't have to look them up on websites. So. And again, most of this is not going to change from the next version. Again, you know, how a bill becomes a law is how a bill becomes a law. So a lot of that, what's going to change is sort of maybe leadership, things of that nature, which is a little outdated in this current version.
Well, we're almost at the top of the hour. I would love to thank all of the panelists and everyone for participating and asking questions today. I think this is such an important topic, and I hope many of you will investigate the toolkit and become more involved in HOPA advocacy initiatives. I think Sarah's quote said it best: we can make changes one person at a time. So please get involved. We'd love to have your voice within our HOPA advocacy network. Thank you all so much. And again, happy Pharmacy Week.